Hi everyone, welcome to Understand Heart, where we learn about anything and everything heart related. Recently, I've received several emails asking about preparing for the Cardiology ST3 interviews. I'm aware that the interview date has been set for ST3 application, so I thought that it may be useful to share some of this information through this video. I will start with the basic structure of the interview, how the scoring system works, and finally some common questions which I prepared for during my previous attempt. Firstly, let's start with the interview format. Of course, this year is different from my previous interview experience as it is now virtual, with only 2 interviewers compared to the previous 6, with 2 from each station. However, the general format remains the same, with 3 main areas of focus, which are suitability and commitment, professionalism and governance, and finally, clinical scenarios. Each of the stations will last between 6 to 10 minutes, totaling to around 40 minutes overall. Each examiner will score you on each individual domain with a score of 1 to 5. Of course, the higher the scores, the higher your chance of being appointed. However, there is a minimum requirement of no scores of 1, no more than 2 scores of 2, and a total score of 24 or above out of a maximum of 40 before you are deemed appointable. This means that you will need a minimum of 3 in all the domains to be appointable. These scores will then be weighted and added to the application score to calculate the final score. A rough guide from previous years in cardiology, the mean and median final scores is closer to 70, so that should be the minimum target you should be aiming for. By the way, this information, which I have shared above, can be found on the ST3 recruitment website, which I have linked in the description box below, so feel free to check it out. Now let's move on to discuss each section individually and how I prepared for it. Let's start with the clinical scenario station. Although this is the last station, I find this the easiest to prepare for, so I think we should start with this. There will be 2 clinical cases to discuss, where the first one you will have the time to think and prepare your answers, whereas the second case will most likely require you to react a little quicker. The main differentiating factor of an ST3 interview to a CMT or IMT interview is that the examiners are expecting a more specialist approach when approaching these clinical cases. The usual of ensuring that a patient is stabilized remains an important aspect, but the examiners are looking more towards your thought process of obtaining the diagnosis, investigating and treating the patient both in acute setting and arranging follow-up. Understanding basic evidence-based treatment is a great way to show knowledge in these clinical scenarios and get great scores. The diagnosis should come naturally, but considering more specialist input of managing these conditions will let you score better. This means that rather than just stabilizing and managing the patient initially, you should be thinking about how you would manage these patients in the longer term, i.e. arranging follow-up and further prognostic measures. Some common clinical scenarios are arrhythmias, which I had Brugada during my interview, coronary artery disease such as ACS and angina, heart failure, and different types of cardiomyopathy, so I would suggest reading up the current evidence-based treatments, which will help you prepare for the clinical scenario station. The ESC pocket guidelines are a useful starting point. The second station will be around professionalism and governance. This was previously combined with an ethical scenario, but it appears to be a discussion-based session this year. Familiarize yourself with the good medical practice guidance from GMC and the 7 pillars of clinical governance. The important point of excelling in this station is not only being aware of the guidance, but also provide some examples which you were previously involved in to show how you understand and use these principles in your daily practice. Some common questions which may come up may be something along the lines of talking about a mistake which you have made before, how you have shown leadership, dealing with difficult patients, relatives or even colleagues, or what I had was mostly around research and ethics. Keep a handful of what I call high-yield clinical scenarios which you previously experienced that may overlap within a few of the guidances, so you can use them as examples in any scenarios when you need to. Last but not least, the first station, which is about suitability and commitment, is probably the one which you can prepare for the most and score the highest. You will have to give a short presentation about why you should be appointed, and will be questioned about your portfolios by the examiners. Ensuring that your presentation covers all the aspects of the person's specification for cardiology is really important. Ensure that you keep within the time limits or as close as to the limit as possible. Vary the length of your sentences, which makes the presentation more engaging and interesting. There will be many applicants saying the same thing over and over again, so make yours stand out. You can do so by presenting the most unique and interesting fact about yourself first to gather attention, followed by the different boxes which you tick to make you a good cardiology registrar. Always support your claims with examples if possible, linking back to your portfolio, making your presentation much more unique and memorable. Remember, the first and last paragraph is probably the most important one, as it will be the one that the examiners will remember the most of. Try and summarize all your points on the final paragraph in a short and punchy way, with something you're most interested in, as it might lead to the next questions they might ask you. Some common questions which would be useful to prepare for would be: where do you see yourself in the next 5 to 10 years? Where do you see cardiology in the next 10 years? Why did you choose cardiology? What are your strengths or weaknesses? Something that you're proud of within your portfolio, such as a publication or an audit, and talking about teaching in cardiology. Of course, there may be many other questions which may come up during the interview, and I have left a list in my description box below so you can have a read and practice some of them. Lastly, do lots of practice with colleagues, especially registrars that have been through it recently, as they may be able to help you calm your nerves. Plenty of practice will make your presentation smoother and let you answer the questions better. These are some useful points to consider when you're preparing for your ST3 interview. I had some help from my peers and consultants when I was preparing for mine, in particular reading my presentation to make sure that I cover all the points, and also the opportunity to practice in front of someone else. Do reach out to your local registrars, as I'm sure most of them will be keen to help. If you find this useful, please like, share and subscribe to support my channel. Thank you for joining me.